Mayo Clinic's operations are assiduously focused on the journey of the patient when they're on our campus. It's not surprising that at Mayo Clinic Laboratories, we have that same level of focus on the patient's specimen. We think about it as we would think of a patient on our campus. And in fact, probably even more so because the patient's not on our campus. It really starts with supporting that provider, supporting that physician so they know to order the right test.
One of the things that makes Mayo Clinic Laboratories unique is that we are integrated into the medical practice at Mayo Clinic, and so the tests we develop are there for serving patients. We're working with our patient-facing physician colleagues and other healthcare providers to really meet the needs of the patients we serve.
It's really the clinicians that know the needs of the patient, and having them available to the labs to communicate those needs helps the lab quickly identify those needs and bring up the test earlier. The lab is also able to help the clinician because the clinician is limited when they don't have a good diagnostic test.
When we order laboratory tests on the physician side of it, we're trying to find a diagnosis, but we're also excluding a lot of other causes, right? So we canvass the waterfront based on our knowledge of which tests to order and what's available. And we use that as kind of a didactic way of determining how to find a disease and potentially treat it. Because you have to ask the question, right? If you don't think about the test and order it, you don't find the answers. Some of them fortunately did that, sent that blood specimen to Mayo where that was tested, and lo and behold, eureka, there was the antibody. So it completely reversed the whole situation with respect to her medical condition. I think that she might not be alive if that test had not been done.
I'm Stephen Brady. I'm a clinical laboratory scientist, and I work in the neuroimmunology lab. When we receive samples within our neuroimmunology laboratory, our laboratory assistants will track in the samples, and they will go into our storage system that would flag it to be ran on the specific test that the client has ordered. Samples processed through the autoimmune movement disorder evaluation examine about 20 various different antibodies associated with different autoimmune disorders. Upon arrival, our samples are transferred or pipetted onto the various different slides that contain the different types of tissues. When the slides are prepared, we place them on our helmets. The helmet takes the diluted absorbed sample and pipettes it onto our 8-well slides. The slide contains mouse brain, kidney, and gut control tissues. After incubation on the helmets are complete, our slides are then viewed under the immunofluorescence microscope. We will see specific staining patterns on the mouse brain depending on the antibodies present. As part of our training, we memorize a variety of different tissue staining patterns that signify which antibody a patient might have. If the patient is positive or suspected positive for that slide will be transferred to the consultants for further review. When the consultant has confirmed the result, we will formally report the result back to the ordering physician. From there, they'll be able to take the next course of action for their patient. In addition to our immunofluorescence assays, the autoimmune movement test uses a variety of different testing platforms to determine antibodies that could be present. Those would be our cell binding assays, our radioimmunoassays, our Western blot assays, and immunoblot assays. It's incredibly rewarding to know that the work that we're doing can actually recover somebody's life and put them back into society, back with their family, back doing what they love to do.